we on?
Yep.
Okay, so we want to show a video on how we would move a patient who has unilateral involvement. So remind yourself, what does it mean to have unilateral involvement? This would be a person who's maybe had a stroke, so one side of their body is not working as well. Maybe they have had hip surgery, so their hip is not moving as well, but unilateral involvement. So they have a strong side and a side that's affected. So our rule is always to try to move to the strong side. That's much easier for patients to move to the side or lead with the strong side as opposed to leading with the involved or the weaker side. So in this case, we're going to imagine that our patient Connor has had an issue with his right side. So his right side is affected, his right leg is not working well, but his left leg is working okay, and we need to get him into the bathtub today. Equipment that we're going to need to have a shower bench. Because he's got one side involved, he will not tolerate being down in the tub very well, and it'll be very difficult to get him back up out of the tub once he was down that low, not having use of an arm and a leg. So we're going to utilize a shower bench. So we'll set the shower bench up so that he has access to it, and it's there facing the faucet. So we want to make sure it's facing the faucet and facing the controls. Ideally, we look for the patient's bathroom to have a handheld shower versus just a spigot, so that he could have access to that and be able to bring it down and use as much of his independence as he could, not having to rely on others. So it's for that reason we would not put his back to the shower faucets or controls, so that he can adjust the temperature and make it comfortable for his needs. Now think about some other things in a shower. We may have doors here. If the person has a shower that has doors, the doors may need to come off. It's going to be much better to have a curtain arrangement than a door arrangement, because we need to have access to get into the tub. So different modifications that we might have to make for patients would be to have grab bars available. They should be installed professionally as rehab professionals. We do not volunteer to do that. If, God forbid, it comes out of the wall and you have installed it, you are now liable and responsible for any injuries the patient may incur. So we need to be mindful of those types of things. So handheld shower, position so they're facing the shower controls, grab bars, or there are suction grab bars. You can see the example of the suction grab bar there behind. Those install nicely onto walls so that they can have access to those things. But that should all be done professionally, not by you, or if a patient decides to have a family member do it, then it's on them. The other thing to be mindful of is that Medicare will not pay for any equipment inside a bathroom. So bath benches and grab bars are not Medicare eligible items. These are personal expenses on behalf of the patient. Okay, so with all that being said, we want to be mindful about how do we get our patient into the tub with unilateral involvement. So first of all, we want to make sure that we're getting him as close as we can. He has use of this arm and this leg, so he can move this leg off. In fact, he probably would not even have this actual footrest on. So that the patient has the ability to manipulate and move himself. And I'm going to move you just a little bit closer, because we want to get you as close as we can to that area. We'll move the armrest up on the side that is closest to the transfer surface. And again, we've got it positioned so that his strong side will lead. Now this leg needs to come off the footrest, so if he can do it, he would have to either use his other leg with a hook method. So he'd hook behind, or we would help him. But we'll get that out of the way and make sure that he's fully engaged. Should we take this armrest off? Why not? Sure, we're going to use that armrest for support, so there's no reason to take the armrest off. Now we've got him in this position. We can have him start to scooch forward if he has the ability to do that. Perfect. And now that he's in this position, we can ask him to put his strong leg inside the tub. With his strong leg inside the tub, now he can start to reach across, use the muscles of his hamstrings, and use his hand to start to move him over and across, and we'll help him facilitate with whatever he needs to reach across. He can grab for the grab bars, he can grab for the edge of the bath bench, whatever is necessary. Once he's over and safe, now he can hold on here, bring this leg back out to hook, bring that all back in, and now he's all set for in the shower, rub-a-dub-dub. Now clothing. He could take his clothes off while he's in the wheelchair, so he transfers without. He's got the support of the wheelchair to do that effectively. That would be the safest place for him to do that. When he's coming back, we're going to reverse the process, but he'll be wet. So we want to dry him off as much as we can, and then most likely put a towel in the base of the wheelchair. So he'll transfer back over and get dressed in the wheelchair. We want to keep the wheelchair dry. So to come back out, he'll hook his leg like he did this time and bring him out. Now this time he's coming toward his involved or weaker side. This is harder to do. So you and I as clinicians may have to help him more. So we're going to let him do as much as he can, but also help him as much as he needs. So he's already pushing with his strong leg and his strong arm. We're going to stay close and protective. And he's able to slide back over into the wheelchair. Once he's comfortable and back, he can move his armrest back down. Help him get back situated, and take his other leg out, and dressed and dried and everything that he needs. Good?